Good day everyone, I am Jamaica Andan, student nurse from Our Lady of Fatima University, Pampanga campus. For today's return demonstration, we're gonna perform the warm compress and cold compress. So before that, we need to verify the doctor's order. So the doctor's order is to apply 30 minutes warm compress to the patient. So we have to review the chart and assess the patient's skin. So we assess and inspect the patient's skin and the client temperature and pain sensitivity. Ma'am, masakit po ba yung nararamdaman nyo sa wound area nyo?
Yes po.
And also, assess the client vital signs. After assessing the client vital sign before the procedure, we have to identify the patient and provide privacy. Ma'am, can you state your name and your birthday?
I'm Andan, March 26, 2006.
And after that, we're going to hand hygiene. After the hand hygiene, we're going to explain the procedure to the patient. Ma'am, ngayon po, mag-a-apply po ako ng warm compress sa infected area nyo. Makakaramdam po kayo ng konting mahapde kasi po mainit siya. And also, you have to sign po sa consent kung approve po sa inyo lahat ng gagawin nating procedure. Ma'am, can you sign this po? And after that, we're going to place the underpad on the patient arm. Also, after putting the underpad, we can assess the patient. So we are ready to apply the warm compress to the patient. It's just a warm so the patient can tolerate the pain. The doctor's order is 30 minutes, but we're going to check the warm compress every 5 minutes to check and assess if there's a discoloration. And after that, we're going to remove the warm compress and assess the effectiveness. Ma'am, okay lang po ba kayo sa nararamdaman nyo ngayon?
Yes, mas naging comfortable ako.
And after that, we're going to remove the underpad. And we need to compare the vital signs. So, before and after the procedure, we're going to take the vital signs of the patient. After checking the vital signs are normal. We have to document it. And lastly, we need to remove our gloves and perform the hand hygiene. After applying the warm compress, we're going to do the cold compress now. So we have to explain the procedure to the patient. Ma'am, mag-a-apply po ako ng cold compress sa infected area nyo. Okay lang po ba?
Yes.
Medyo makakaramdam po kayo ng hapde kasi po malamig po yung ikakabit natin. But before that, we're going to assess the skin of the patient. So we inspect and there's just one but there's no discoloration. So we have to perform the hand hygiene. Ma'am, can you state your name and your birthday?
I'm Andan, March 26, 2006.
And we also need to provide privacy to the patient. And also, we have to check the wristband if this is the right patient. So, before proceeding, we have to check the vital sign, also check the doctor's order. So, the doctor's order is perform a 20-minute cold compress. So, ma'am, I'm going to apply the underpad on your arm. and just prepare the cold compress. I'm going to apply it na po. So, we have to check the condition of the patient, the inspected area, every 5 minutes and stop application if there's a problem. So, after checking every 5 minutes, we're going to stop it after the doctor's order, which is 20 minutes. And after that, we're going to remove our gloves. And we're going to inspect the wound of the patient. And after that, we're going to remove the underpad. Also perform the hand hygiene. And ask the patient, what is the level of comfortness? Ma'am, rate 1 to 10 kung ano pong nararamdaman yung comfortness na yan. Yan, after that, ma'am, burning sensation po ba? Nakaramdam po ba kayo na yung sugat nyo is hindi nyo na matolerate yung sakit while applying the cold compress?
Hindi naman.
Yan, after that, we have to compare the vital signs. So, after taking the vital signs, na-check naman natin na there's no abnormalities, normal lahat ng vital signs, and we document the procedure. So, that is the end of our warm and cold compress. Good day everyone, for today's written demonstration, we're gonna perform the post-mortem care.
The first step, close the windows or curtains to provide privacy. And then, prepare all the equipment sa tabi ng patient. And then, ilagay sa comfortable na position si patient, which is the supine position.
So we have to remove all the sheet, blankets down from the patient, and also remove any drains, tubes from such are IV fluids, Foley catheter, and heart monitor. And if you are unsure which one you have to remove first, you have to notify the physician. And after that, we have to remove the glasses. We have to put that in the container and any accessories of the patient, and that it will be put inside the bag of the patient. So after that, we're gonna perform the hand hygiene.
And also, put the gloves on.
After the hand hygiene, we're gonna consult to the family if she need time to be on the patient sides. After that, now we're gonna perform the bed bath.
But before that, let's remove first the glass.
Remove the glasses and the linens. after that, we're gonna cover the eyes, the nose, the mouth, and the ears of the patient. Also, we need to secure the mouth of the patient. And after that, we have to place the hand. And after that, we're gonna ask the family if she want the patient be naked and or have the gown on. Ma'am, what do you prefer po? So the family decided to put the patient in a naked position while in the caliber bag, and but for now, we're not gonna do that. And after that, we're gonna put
the name tag, sa paa ni patient, of the patient for the identification.
and after that, preparing the caliber bag, we're gonna put the patient on the caliber bag. Wala pa. Yung ano pa, yung ano pa. After putting the patient, ako na lang. After putting the patient on the cadaver bag, we're gonna remove the pillow and any linen of the bed and any sheets of that. After putting the patients on the cadaver bag, we need to put the belongings of the patient together with, and we have to secure the cadaver bag. So we have to zip this and lock. since it's unlocked, so to secure the identity of the patient, we have to label it again inside the cadaver bag. And also, for last, we have to do the
Hand hygiene. And that's the end of the post-mortem